Hello and good evening, everyone. Welcome to the 118th Blue Hills Virtual Seminar. Blue Hills Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. And today's virtual seminar is a webinar series, session 1, which is brought to you by Blue Hills Ethiopia in collaboration with Green Hills Africa. Blue Hills Ethiopia is a medical consultancy company founded by medical doctors and a computer engineer, and we aim to be an influential healthcare leader in creating a skilled community through easily accessible knowledge and preventive medicine. And I'm your host, Dr. Heno Tadela from Blue Hills, Ethiopia. Today, it's a pleasure having Abraham Misganaw here with us to have a presentation on climate change and health understanding the links. This is session 1 for a 3 webinar series. So our speaker today is Abireham Misganaw from Pathfinder International, Regional Climate and Health Advisor for Africa. And the seminar will be moderated by Elbet Alamo.
Thank you so much everyone for joining us for the session 1 of the Climate and Health webinar series, and it's brought to you by Green Health Africa. My name is Abireham, and I'm honored to be your moderator this evening. So first, I want to just say a few words on Green Health Africa. It's a youth-led initiative working to build climate-resilient health systems and health workforce, which are equipped for the future. And our mission is to integrate sustainability and climate awareness into the health sector, education, and leadership. And I want to say thank you for Blue Health Ethiopia for collaborating with us to offer this platform, and also Pathfinder International for championing climate health integration at the regional level. And also Global Youth Mobilization, Youth Empowerment Fund, is also supporting us to pilot this initiative. And it's now my great pleasure to introduce today's speaker, Mr. Abireham. He's a seasoned, dynamic, and results-driven public health and development professional with over 13 years of experience spanning climate, health, WASH, and emergency preparedness. He currently serves as the Regional Climate and Health Advisor for Africa at Pathfinder International. He holds a Bachelor in Health Promotion and a Master of Public Health and Environmental Health. And he has led multi-million-dollar climate and health programs, and he's mobilized over 50 million USD in funding and built strategic partnerships across sectors. He's spearheaded the development of national climate health policies, including HNAPs, and represented Ethiopia and Africa at high-level platforms such as UNGA, Regional Climate Week, and COPE. He strengthened institutions, built capacity hubs, and mentored the next generation of climate health leaders. And he's a powerhouse of knowledge and action. We are beyond honored to have him with us today. So without further ado, please join me in welcoming Mr. Abireham Ayalo, to Mr. Abireham Misganaw to share with us on the topic, climate change and health, understanding the link. Mr. Abireham, over to you.
Thank you very much, Elbetel. Welcome, teams. Good morning, good afternoon, good evening, colleagues across the country and also actually from the region. My name is Abireham Misganaw. Currently, I serve as Regional Climate and Health Advisor for Africa for Pathfinder International. So, as Elbetel said, I have been in the government sector and also in the NGO sector on climate, WASH, and health nexus activities for the last 13 years. Today's session mainly focusing on climate and health, the basic concepts, or kind of 101 climate and health concepts, and also some of the impacts that we encounter due to climate change. It's as it's clearly said, it's 1.5 hour session. So the session mainly actually organized to actually provide an understanding on the basics of climate and health, and also actually to understand the impacts of climate on health, as well as what are actually the basic global responses to climate change, as well as introducing some of the impacts of climate in Ethiopia. So our agenda have these five topics. The one is key climate and health concepts, mainly focusing on some of the terminologies that we use for climate and health. Second one is mainly focusing on why we are actually focusing climate change, and also third one is the impacts of climate, especially on health, and details of actually climate change impacts. The other one is mainly focusing on the global responses, what the global leaders are doing in response to climate change, and I just highlight some of the impacts that we actually encounter for the last 30 years here in Ethiopia. So I will try to highlight some of the backgrounds and also some of the impacts of climate on health specific to Ethiopia. So as you have the thickness of actually atmosphere and also the concentration of its gases influence the surface temperature for any planets. As you have seen from the slide, Mars, Earth, and Venus have actually different thickness of atmospheres, and also with that thickness of atmosphere, they have different ground temperatures as well as average temperatures in each planet. So Mars have actually thin atmosphere and also having all the carbon dioxide within the ground. So the average temperature is below 50 degrees Celsius. When you come to Earth, it's 0.03% of carbon dioxide in the atmosphere. So the average temperature is actually 15 degrees Celsius. When you come to Venus, so it have a thick atmosphere containing 96% of carbon dioxide. So it have around more than actually 420 degrees Celsius average temperature. So when the thickness of actually the atmosphere increase, the Earth's temperature also proportionally increased across the different planets. When we come to the greenhouse gas, especially how the Earth can be actually make up, as you have seen from the picture, the Earth is actually mainly surrounded by a thin layer. We call it the greenhouse gas. So the greenhouse gas mainly contains carbon dioxide, methane, nitrous oxide, ozone, that's O3, and some of the water vapor, especially from the big oceans. So the majority of the greenhouse gas are actually composed from these main gases. So when the sun actually gives its temperature to the earth, some sunlight that heats actually the earth will be reflected back to the atmosphere. So it become actually heat. So when the atmospheric actually thickness increase, that's a carbon dioxide amount increase, the Earth's climate or the Earth's weather and warmth will be increased. That means it will increase the thickness of the atmosphere. That is increase actually the Earth's temperature. When we come to some of the terminologies, actually, we actually use interchangeably in most of the cases, but the terminologies have some differences. When we come to the first one that we actually daily encounter is weather. So the weather, when we are actually saying weather, it's actually what's happening in the atmosphere at any given time. For example, today here in Addis, in the morning it's a bit cold. In the midday it will be actually sunny and also a bit hot. When you come to in the night time, it's a bit windy and also a bit humid. So we call it these kinds of happenings weather. When you come to actually when you say climate, the actually average weather condition. For example, if you are actually facing consistent weather condition for more than 30 years. We call it climate. For example, with some of the examples, for example, in the highland parts of the country, we regularly encounter actually cold weather conditions for a long period of time. So we call it climate. When we say climate change, those climate conditions will be changed. For example, the climate condition of Addis Ababa was changed for the last 30 years because of the climate change. In most of the cases, the routine climate conditions are now changed. Even some of vector-borne diseases like malaria also have reported here in the highlands parts of the country. So we call it that a climate change. So the climate characteristics will be changed with a long period of time. We call it climate change. So when we come to the other word, we call it mitigation. Mitigation mainly actually is reducing or preventing the emission of those greenhouse gases, especially carbon dioxide and methane, that contain actually the heat and also actually making the earth warm. So efforts or any activities that we done to actually reduce or prevent such kinds of emissions, we call it mitigation. For example, afforestations or planting of trees are considered as a mitigation measure for climate. When it comes to adaptation, it's actually adjustment in human or natural system in response to actually the climatic conditions. For example, when we're actually saying climate adaptation, we will actually redesign our infrastructures, our housing conditions, our living conditions that will fit with the regular climate conditions. We call it adaptation. So adaptation is mainly adjusting in human or natural systems in response to actually the actual or expected climate variations. So the mitigation is mainly on prevention measure, whereas adaptation is it's more about adjustment. So there are actually some regularly interchangeably used words. We call it global warming and climate change. When we say global warming, it's mainly focusing on temperature only. When we say climate change, it's not only temperature, it have actually humidities, wind directions, and other conditions. So climate change is a bit broader than global warming. Global warming mainly focusing on the atmospheric temperature changes through a long period of time. The other key terms that we use in the climate and health space is resilience. So resilience is actually mainly related with the ability of actual social or ecological system, or the ability of an individual, a community, a system, or any kind of ecological system that will actually cope with or absorbing the disturbance that comes because of climate change. We call it resilience. When you come to exposure, it's actually susceptibility of actually individuals or any kinds of properties for any kinds of climate change. We call it exposure. So we will actually go in details of this climate resilient health system in the second webinar. So as a terminology, when we say climate resilience health system, it's actually a system. So a system having actually, as you know, the WHO have actually 6 health system building blocks. So those building blocks or the system having the ability to anticipate, respond, cope with, and recover from, and also adapt to climate resilient shocks and stresses, we call it climate resilience health system. So a system, when we say actually a system is resilient, the system have to actually anticipate any happenings like shocks or stresses like floods, droughts. So the system have to anticipate such kinds of changes. If those kinds of climate hazardous shocks, stress are coming, they have to be responsive and also coping such kinds of shocks, as well as recover from that shock and also adapting that shock. So we call it that climate resilience health system. When you come to the health facility level, the healthcare facility or resilience healthcare facilities are mainly related with climate risk assessment and also taking adaptation measures. So facility level actual resilience is more assessment and also adaptive management. When you say climate resilience system, it's more a system that will actually provide regular services within any kinds of disturbances or climate shocks. So the other is mainly related with hazard. So it's actually the event with a potential to cause harm. So we call it hazard. Like flood is a hazard, drought is a hazard. So we call it that an event that's happening due to climate change. The vulnerability is more related with susceptibility. The other one is risk, and so climate risk is more climate hazards and also vulnerability, a kind of combinations between hazard and vulnerability. So the other key terms that we have to know when we are actually discussing on the climate resilience health system is the WASH or the health building blocks. This is the WHO health system building blocks. It's actually consistent across the different organizations, whether the rearrangement is a bit changing, but the pillars or the building blocks are more or less similar across the different organizations. So WHO actually indicates this six building blocks as a health system building blocks. So when we say climate resilience health system, all these functions have to actually respond against any kinds of shocks or disturbances because of climate change. So we will see actually in the system how the component will be absorbing any kinds of hazard. So the major actually component of the WHO health system building block is leadership and governance. The other is health workforce, that is the healthcare workers. The other one is health information system, mainly related with monitoring, evaluation, learning, and impact kinds of activities. The other one is mainly supply chain and technologies, that's medical products and technologies. The other one is the actual clinical service, we call it service delivery. The other is financing those deliveries, amenities, and also products in supply chain, as well as the leadership and workforce. So these are the building block of climate, the building block of health system. When we come to actually why is climate happening? Climate is actually happening because of human activity. Climate is not actually coming all of a sudden or from somewhere. We are the one actually causing climate change. So climate change is happening because of human activity. Different human activities actually causing climate change. The first one and the most affected or the most cause for climate change is burning of fossil fuels. In most of least developed countries, including Ethiopia and other African countries, we use fossil fuels. We are not using actual renewable energy or any energy sources. Rather, we are using fossil fuels. So we use oils, natural gas, or coals for our energy purpose, for our homes, for our cars, for our factories. So all these fossil fuels or burning of these fossil fuels cause release of carbon dioxide. So carbon dioxide is one of the greenhouse gas that will actually create warms to the or warming the atmospheric temperature. So one of the human activity that will contribute significantly for climate change is fossil fuel burning. The other one is mainly related with deforestation. So in most of the cases, when we are saying afforestation or tree planting, we have two purposes. One is actually absorbing the carbon dioxide. So plants are actually using carbon dioxide for their growth. So when we are actually cutting or deforesting those trees and also forests, we are actually creating more carbon dioxide in the atmosphere and also in the so that will create warms, and we call it that's climate change. So if you are actually less trees, that's actually less carbon dioxide removal from the atmosphere. So that will create. The other is actual farming activities, and also some making cement activities are also some of the causes for climate change. So as we have seen from the pie chart, fossil fuels contributes for majority of actually the contribution for carbon dioxide emission into the atmosphere. Coals, natural gas, and also hydro, nuclear, geothermal, renewable energy, especially during the extraction period, have actually contributed also for the emission of carbon dioxide to the atmosphere and also making climate change. The other gas is mainly contributed for climate change is methane. So methane mainly comes from livestock farming, sanitary landfills, and also from the farming, like the rice growing activities. So, and also mainly from fossil fuel extraction also, we release methane. After the Industrial Revolution, that's after 1966 in the European calendar or in the Gregorian calendar, the amount of methane in the atmosphere is actually increased by 2.5 times. That's nearly doubled for the last 15, 16 years in the atmosphere. So especially from the animal products, they generate a huge amount of methane. So we have to actually manage the methane release to the atmosphere, that or in sanitary landfill, especially when soil dust is actually disposed, collected, and also actually reprocessed in sanitary landfills. They actually generate a huge amount of methane that will also contribute for the greenhouse gas emission and also warming of the earth. So this is a bit pictorial presentation of what natural greenhouse gas means and also some of the human enhanced or affected greenhouse gas. So as we have seen from the picture, solar radiation directly comes from the sun, will be reflected by aurora or radiated by back to the atmosphere. So in the normal circumstances, this chain or these kinds of circles are going in normal. That means the greenhouse gas thickness is as expected, and also the thickness is as it is. When we come to actually huge fossil fuels burning, methane emissions, the thickness of the atmosphere or the is a bit thicker. So when the solar radiation coming, the proportional amount of actually heat is not actually back to or reflected back to the atmosphere. It's not actually back to the atmosphere. Rather, it's actually will be in the earth. That creates actually heating and or warming of the globe. That's we call it greenhouse gas effect. So the thickness of the atmosphere is the one that we actually affected by the different gas emissions, especially the carbon dioxide, methane emissions. So this layer have to be actually have to be back to the actually the normal. So the different activities like tree planting or afforestation, use of actual renewable energies, solar energies will help actually to reduce the proportion of carbon dioxide in the atmosphere. That will actually reduce the significantly the warming of the earth. So especially in terms when you come to biosector, as you have seen from the causes, the electric powers and also transportation are the one that highly contribute, especially the sectors, the electric sector, that means the energy sector, the transportation sector, industry sector are the main emitters of carbon dioxide and also greenhouse gases. So any mitigation or an adaptation measures have to be taken within this sector. So the emissions from actually energy sources, from the vehicle that we use as a fuel gas, the industries, from the agricultural products like methane and also huge rice productions, the commercial components, that's actually more waste related kinds of related kinds of emissions. That's greenhouse gas emissions are also actually the causes of climate change. So that's why climate is actually changing for the last 13, 14 years. So why does actually climate matters? Why not we are actually going as it is and also living as we want, and also why we are bothering about climate and climate change. The first thing is actually climate change is already damaging natural environments, especially the North Poles or the glaciers are actually melting. So the natural environments are not actually degraded. So it's already start damaging natural environments, and many species currently are actually struggling to cope with rapid changes of climate change. So those actual species who are actually living in the North Pole or are actually are struggling actually to cope and to live with the changing climate conditions, and also different vectors that are actually already in the tropical areas or within the glacier areas are actually changing their actual vector reproduction and also their epidemiological characteristics, and actually some of the even already eradicated vector bodies are now re-emerging like chikungunya. So we are actually bothering because the natural environment is damaged because of climate change. The other thing is, for the last 25 years, the warmest actually years actually recorded 16 out of 17, the warmest years are recorded for the last 25 years. So each year we record actually the highest warmest years or average increment of Earth's temperature because of climate change. So if the Earth's temperature is changing, many changes, the lifestyles, the technologies, everything will be changing. So that's why we are actually bothering because of climate change. The other thing is extreme weathers is now become more common. Floods are now more common, landslides, droughts, such kinds of events are now become more common than the earlier time. So we actually bother about climate change, and we are actually concerning about climate change. The other is especially the sea levels are now actually, especially the ice levels are decreased. For the last 10 years, there is 30% decrement of the ices, especially sea ices in the North Pole of the Earth. That's also have impacts in our lives and also in the species that are actually living in those climatic zones. Another one is especially some of the evidence that we actually get, especially from the US environmental agencies and also the NASA data, says one of from the 6 species is now at risk of extinction due to climate change because of actually changing the conditions or the climate variabilities. The other is actually climate extreme weathers, flooding, drought, landslides, is now actually displacing millions of people around the world. And also, the other thing is that in addition to actually, even if it's climate has affected everyone, but those who are the poorest and those most vulnerable peoples are actually the hardest hit by climate change. So, especially those who are living in slum areas, in the what we call it, riversides, slum areas are the one that's hit hard by climate change, and also those who are actually we call it actually poor economically also be actually affected by climate change than those who have actually above the mid-level of the poverty line. So this is actually the data that I generate. Actually, you can also, if you are actually using this link, you can get into, so you can actually interact different data across the globe and also nationally. This is the data from the NASA, mainly focusing on temperature and the carbon dioxide concentration in the Earth. As you have seen from actually this, the red or the square lines from 1880 to 2020, there is actually sharp increment of temperature anomalies. That means the average temperature on Earth is now increase actually, and also the carbon dioxide concentration, as you have seen from the carbon dioxide concentration is actually measured by parts per billion. That means the amount of carbon dioxide within the parts per million, or the kind of cubic meter. So when we have seen from 1960 to 2020, it's actually sharp increase in the carbon dioxide concentration in the Earth. What does it mean? When the carbon dioxide concentration actually increase on Earth, it's a proportional increment of the warmth of the Earth. So when you have seen these two graphs, you have seen actually the link between the carbon dioxide concentration in the atmosphere and also the annual actually, or the average temperature increment across the years. So we care about actually, we are actually bothering climate change. The other one is this picture. As we have seen from the pictures, this is from the northern hemisphere, basically from Alaska, the United States, one of the states in the USA. So as we have seen from 1914, the glaciers or the snows are actually seems like this one. Now in 2004, it's become a river actually. It's become a river. So the species who are actually adjusting themselves to these kinds of living conditions will be actually at risk of extinction because of climate change. So because of climate change, these kinds of glaciers are now become a river. That means it will increase the sea levels in different oceans. The other one is actually the sea level increment. That is, in most of you can also get this data from the link here below. I use actually even the US government, that's the NASA indicators, and also some of the satellite image, 3.5 millimeter sea level increment per year is actually a satellite image. When it comes to the actual, especially in the coastal areas, the average actual increment is 1.7 millimeter. That's 1.7 millimeter per year. That's when the sea levels actually increased. Those populations who are actually in the coastal areas, the species who are actually living in that specific seas are actually in danger, and also there will be actually floodings and also some incidents related with sea level increases, like diarrheal disease due to contamination. So what might actually the world look like in 100 years if nothing is done? If you are not actually bothering climate, if you are not concerning about climate, what do you feel actually after 100 years? What will be actually the actual structure of the globe, the Earth? What do you feel? What might be actually looks like the world looks like after 100 years if you are actually not doing nothing and also actually going as it is? You can actually put your ideas in the chat box. Yeah, you can actually suggest your pointers. What might be actually the world looks like after a year, 100 years? Do you think we will be actually going similar, or we will be actually similar like today? Do you think there will be actually changes? What do you think?
Tinebab Daraje and Tasfaw Seleshi say that the world would be warmer and we will be in a very warm globe than we are now, and desertification will have happened. And other participants also say more natural disasters will occur and the world will be warmer, and there will be rising sea, river salinity will have increased drought, less crops, and there will be mass extinction. Some species will be disappeared from the globe. There will be devastating consequences and many more. Thank you all for your participation.
Thank you very much. So yeah, if you are not taking any kinds of measures, and if you are actually practicing using fossil fuels, using actually non-renewable energies, the globe will not be looked like this one. The glaciers will be melting. I think with current actually trend even, it will be actually difficult for human being also to live with certain areas, especially in the tropical areas. It will be difficult for human being actually to cope with and to live with such kinds of consequences. And also there will be actually huge health problems, especially emergencies, and also re-emerging disease will be coming that will actually have actually a very consequential. Thank you for your feedback. So when we come to actually our main topic, that's climate and health impacts. Yeah, this is actually the WHO framework, how climate affects the human health. So as we discussed in the earlier slides, health risks actually climate change or health risks will be actually related with vulnerability, exposure, and also some of the hazards. So the climate related hazards, we call it extreme weather events like flooding, drought are categorized as extreme weather events. These are the hazards. Heat stress, especially heat stress can be linked with different effects like maternal days, especially related with during the pregnancy times. We will see that one in specific to maternal and child health. Sea level rise, air pollution, vector disease, and ecology. The actually changing in the vector distribution, water scarcity, and also reducing food production are actually some of the climate-related hazards. When it comes to the vulnerability factors, demographics, the population pressure, that means geographically, that's especially those who are in the tropical areas are more affected, will be more affected due to climate change. That's related with heat. The biological factors and health status of individuals are some of the vulnerability factors. socio-political, socio-economic, health system capacity, gender inequity. These are some of the vulnerability factors. And also there are exposures like people in communication, health workforce, infrastructure, energy, water system, food system, health system. These are some of the exposures. So combining all these actually factors, the direct health impacts will be actually related with injuries and actually mortalities from extreme events like flooding, landslide, droughts will actually come up with injuries and mortalities, mass deaths, health-related illnesses, and also respiratory, especially upper respiratory tract infections will be actually increased due to, especially when we are actually using the fossil fuels at household level due to indoor air pollution, it will actually affect our respiratory functions. Another one is waterborne disease like cholera, zoonotic diseases, vector-borne disease like malaria, and also malnutrition for borne disease, especially the food. We'll see that one also in detail, and NCDs, and also related with the heart attack and other NCDs, and also mental health health impacts. In addition to the health impact, it will affect the health system itself, especially the health system have actually both contribution to the greenhouse gas as well as it will be affected by the impacts of climate change. So we are actually using improper waste management at healthcare facility level, our incinerators, our placenta pits, our actually ash pits, or those who we use actually open burnings that will actually even contributing. Even our water use within the different wards also have its own contribution, especially in those water scarcity areas. So it have actually direct impacts in the healthcare facilities and also in the health system. So this conceptual framework is actually developed by WHO as a framework that will actually explicitly indicating the climate impacts on health. When we are actually seeing the impacts, I think we have to actually think of the vulnerability factors as try to see in the slide, in the first slide here. The vulnerability factors will change actually the impacts or the final outcome of the climate. So climate change affects everyone, but vulnerability affects also the extent. Like those individuals who are actually already existing kinds of reported disease like heart, hypertension or something, it will be actually much higher probability of actually of effect than those who are actually considered as normal. So it affects everyone, but the extent will be actually depends on the vulnerability. So hazard impacts differently on men and women also. That's gender issues. For example, during pregnancy, men are actually differently affected by climate change. It have actually some physiological changes also. Those other peoples also have actually the vulnerability factors. So as tried to say earlier, it's not actually climate change directly is not actually coming alone. Rather, it will actually combine with existing hazards and also vulnerability. So when we're actually thinking some kinds of responsibility or responses, I think no one actually one size fit for all climate change response. So our response will be actually differ from place to place, from vulnerability factors and other parameters. So some of actually the vulnerabilities also we consider and also actually the impacts. For example, when we are actually see extreme heat, this is one of actually the hazard that we expect due to climate change. So the climate driver is actually more frequent, severe, prolonged kinds of heat events. So that will actually expose elevated temperature, and also it will come up with health-related deaths and illnesses. So the impact will be actually rising temperature that will lead to increased health-related disease or heat-related diseases and also illnesses. Outdoor air quality, flooding, vector-borne disease, waterborne infections. These are actually some of the climate variabilities that will actually affect the health. So in general, climate have actually a direct and indirect impact. So we can categorize as direct or indirect impacts. The direct impacts will be actually directly related with actually the impacts because of actually the climate hazards like flooding or any landslide or any other scenarios like days due to extreme weather such as droughts, floods, heavy rainstorms, landslides. We call it actually, we can categorize as direct health impacts, heat stresses, physiological effects of exposure to higher temperature, and also increased incidence of actually NCDs, such as respiratory and also cardiovascular disease and injuries. This we consider as a direct health impact. When it comes to the indirect ones, especially the ecological changes, such as food and water insecurities, that is affecting actually nutrition and also actually waterborne diseases. Spread of actually climate sensitive diseases like malaria, chikungunya, yellow fever, because of climate change, they're actually they will change their actual epidemiology, so it will affect the human being, but we consider as indirect impacts. The other one is population displacements due to climate change, reduced access to health services due to climate change. Like the direct hazard will actually affect the healthcare facility. It will destroy the healthcare facility. So the community or the catchment population will not get actually kinds of services. That means it have actually indirect impacts. The other way around, if there is a drought, the healthcare facility will be actually out of wash services, water supplies, sanitation and hygiene services. So due to that, healthcare acquired infections will be actually prevalent in that specific area. So it will considered as actually indirect impacts of climate change. So yeah, let's go to actually some of the specific actually impacts of climate on health. One is the impacts due to actually on maternal and child health, especially maternal health. So climate factors, especially temperature, food insecurity, water quality, and extreme floods are actually these impacts. For example, temperature will have actually high blood pressures, heat stresses, cardiovascular failures, and also epilepsy risks, especially in infants. It have actually. I will share with you actually the evidences. In the last slide, I have a list of actually papers, published papers that will actually refer for other use also. So you can also further read that one. So it have actually some resources or references. The other one is food insecurities, that is gestational diabetes, malnutrition, poor fetal actually development, miscarriage can be related with food insecurities. That's actually come up due to climate change. Water quality, water quantity. When we're actually quality, we are mainly focusing on the bacteriological and also chemical quality of the water. That means the E. coli, for example, contamination that's related with latrine, chemical contaminations from the different wastes as well as that's so the when we are actually saying water quality, it's more about safety. When it comes to quantity, the amount that we use actually for our specific purpose, for hand washing, for cleaning, for drinking or something. So climate affects both water quality and quantity. So water quality and quantity have actually its own impact on fetal infections, severe dehydration, cholera. In fact, mental retardation also related with water quality and quantity. Especially the retardation ones are mainly related with heavy metals concentration, especially those in the urban, in the periphery of actually the urban areas. For example, here in Addis, one of the biggest river in Addis is actually the Akaike River. So when we're actually googling one of the evidence that's actually prepared also done by the Ethiopian Public Health Institute on Akaike River chemical contamination, it have arsenic and also different heavy metals that's actually categorized as carcinogenic by the WHO category. So water quality have actually its own impact on mental retardation. So that's also another one. Extreme floods like forced migration, malaria, mental health, and also inaccessibility of healthcare facilities. So these all are actually linked with maternal health impacts. The other one is impacts related with wash, actually water sanitation and hygiene. Water and sanitation and hygiene is not actually come up with only by climate change, but one of the factors is climate change, like less water for drinking, or hand washing, for flushing, or too much water, for example, that's flooding, damaging of infrastructures, that's wash infrastructure, water supply infrastructures, contaminated water, like when flooding happens, it will actually destroy all the sanitation and hygiene facilities. So the water facility will be contaminated by the latrines or the fecal matters. So that means the quality of the water will be depressed, and then it will increase these burdens. The other one is increased pressure on services, especially when the groundwater service is depleted. It will actually pressure on the service provision, service interruptions. These are some of the impacts on WASH. When we come to actual food safety, nutrition, and actual distribution, temperature and actually precipitation, that is actually like flooding is the precipitation extremes. The extreme of actually precipitation can actually increase pathogen loads. So if there's flooding, it will destroy the different facilities, including the latrines, that will actually contaminate, or pathogens will be actually contaminating the food system, like especially those who will be actually used as a raw, like lettuce and other foods, or the other one is climate also alter the weeds, insects, and the fungal populations, and increase actually pesticide use. So when we're actually using much pesticide, it will affect the food system also. The other one is warm temperatures can even greater food spoilage can be linked with warm temperature. Extreme climate events can also disrupt food distribution systems, and also rising carbon dioxide can also directly influence nutrition content of the foods. So these are some of the impacts of climate on food safety, nutrition, and distribution. When it comes to mental health, especially those extreme climate events like flooding, drought, landslides, it have its own mental and well-being impacts. So the medical and physical health impacts are related with change in fitness and activity level, health illness, allergies, increasing exposure to waterborne and vector-borne disease. When it comes to mental health, especially in those extreme events like flooding, landslide, like the one that we experienced last year in southern Ethiopia, it will actually create stress, anxiety, depression, and also a grief, some of actually, and also sense of loss. The other one is strains on social relationships, and also in some incidents, it will lead to substance abuse and also the post-traumatic stress disorders. The drought effects that we experience in Borena, the landslide that we experience in southern Ethiopia, the drought that we experience in the northern part, especially in around Sakota and the Wagamra zone. These are actually some of the impact. These kinds of actually extreme events will have actually mental health impacts. These are some of the issues. So when we're actually discussing this one, we are not actually talking about what will be actually the role of actually the leaders. Before actually we go to the different global commitments and responses to the climate change, what do we need actually the leaders to do to tackle the climate change? What do you think? What can our leaders can do? As an individual, actually community leader, what actually the leaders can do to change this one? Just 1, 2 points in the chat box.
Timbab Daraji said awareness creation must be the first step. And others also said become change agents, and leaders must be aware, must make the community aware about prevention mechanisms. And also another person mentioned advocacy that's needed to convince leaders that climate change is an health emergency and they must act now.
Thank you. So when we are actually thinking leaders, we have to think about one, policy related issues, because they are the one actually who provide or who give us policy directions, making decisions in policies. Second one is actually related with financing. Third one is actually related with response. So improving the capacity, especially when are actually saying the system have to be actually strengthened in multiple ways. So we have to strengthen that one. Strengthen the system by strengthening the workforce, by creating a resilient service delivery, by availing sustainable finance for the system, monitoring and giving guidance based on the evidence, and also that's we call it evidence-based decision making. So leaders actually the scope will be different, but I feel that everyone was actually a leader for himself. So we have to actually one, as an individual level, we can make decisions like reduction of use of actually fuels. That will be actually some of the individual level measurements. As a community leader, for example, if you are actually working in healthcare facilities, and also if you are actually leading some of the healthcare facilities, we have to actually mobilize the community. We have to actually making the healthcare facilities resilience by making different measures. For that purpose, we have to take actually some leadership role. So everyone was a leader, and we have to be actually act for tackling the climate change. The bigger one, the higher level leadership roles will be actually more financing, policy, and such kinds of issues. So when we're actually saying leaders, we are leaders. Everyone is a leader, especially the professionals, the healthcare professionals. You are a leader for your healthcare facility. You are a leader actually to change some specific catchment population. So you have to take actually that specific measures to tackle the climate change. So what are actually some of the policy level climate change actually responses at the global level? These are actually some of the global level commitments. One is in 1994, the United Nations Framework for Climate Change Convention was actually established. That means COP, we call it currently. Now we are in COP 29 this year. It will be COP 30 in Brazil. So the Conference of Parties, or COP, is actually one of the advocacy area that those who are actually vulnerable, countries like Ethiopia, and most of actually sub-Saharan African countries, advocate and also actually negotiating with the global actually high greenhouse gas emitter countries to pay in proportion to their actually emission levels. That's actually related with the Paris Agreement. I will be back to that. But the COP is mainly the advocacy session. We actually demonstrate some of the best models for resilience, adaptation, mitigation measures. So we will learn from the different corners of the globe, the different thematic experts will be actually in that advocacy and actual meetings. So they will present the technical expertise, some of the demonstrated models, and also the policy recommendations for the global leaders. So COP is more an advocacy mechanism of forum. The other is these two funds. The one is Green Climate Fund. That's actually established similar with the UNFCCC, Triple C, that is, and adaptation. These are actually full funds that will be actually provided fund for countries who are actually in alignment with the different climate policies and strategies, and so taking measures to mitigate and adapt the climate impact. So in 1994, UNFCCC or UNFCCC was established. This is one of actually the big milestone for the response to climate change. The second actually one is the Kyoto Protocol, in which every country actually taking a commitment to develop a national programs to reduce their emission of the greenhouse gas. So in actually saying Kyoto Protocol, every country agreed to develop a program to reduce their emission, especially the greenhouse gas emission. Following that, the big milestones are coming in the Paris. That is in the, I think, 2022 or 23rd COP meeting. In that meeting, the global community agreed to limit the global warming to below 2 degrees Celsius. So the graph that I show in that, especially the temperature increment, the proportional increment of the temperature, have to be actually limited at some point in time. So the global leaders agreed to limit the global warming by 2 degrees Celsius by 2030. This is one of the commitments in the Paris Agreement. The other one is the national determinant contributor. These are actually the commitments, country-specific commitments that will be submitted to the UNFCCC, indicating the different commitments that the countries are taking or taking in response to the climate change impacts. So the NDCs currently, almost majority of the countries already finalized the second NDC reports, currently even including Ethiopia. Currently they are actually updating their NDC. So they will commit themselves in the certain amounts of actually mitigation and adaptation measures with some specific sectors. This is the big milestone. So based on the commitments, the progress against the commitments, some of these funds are actually available for countries to implement their commitment. So any country, especially government-led projects, can be developed to be submitted for the UNFCCC for funding and actual implementation. These are some of the areas. So the other one is the global goal of adaptation. So in the Paris, the global community actually agreed the goal of adaptation. We call it the global goal of on adaptation. So there are different adaptation measures that will be actually implemented across the globe. These are some of the goals. So after the Paris Agreement, there are Glasgow, Sharm el-Sheikh working documents, the last UAE framework for global climate resilience. These are some of actually the global responses. So these global policies are now translated to national contexts. The other is mainly related with SDG. So as you know, SDG have actually health and climate and also WASH goals and targets. So the more familiar ones in relation to climate are one is goal 1, that's reduction of no one to be poor by end of 2030. That's no poverty, we call it. In that goal, the global actually, or any countries are committed by 2030, building the resilience of the poor and those in vulnerable situation and reduce their exposure and vulnerability to climate extremes events. So the third is mainly related with health. So by 2030, end the epidemic of AIDS, tuberculosis, malaria, NTDs, that's a neglected tropical disease, and combat hepatitis, waterborne disease, and other communicable disease, which is directly linked with climate. The other is reducing by 1/3 premature mortality from NCDs through prevention and treatment of mental health and well-being. It's also linked with climate. The other one is by 2030, sustainability or substantially reduce the number of actual deaths and illness from hazardous chemicals in air and water pollution and contamination. The 13th goal is actually climate action, that's strengthening resilience and adaptive capacity to climate-related hazards and natural disasters, and improve education awareness raising and also human and institutional capacity on climate mitigation. These are actually the few actually targets. Within target one even, you may actually link climate with some of the targets. For example, when we are taking goal 6 related with water sanitation and hygiene, you can link with climate. So climate is actually linked across all the goals, but for sake of actually this presentation, I just actually select these goals and targets. Okay. After actually saying this, let me back to home. So climate and health in Ethiopia. What are actually some of the points that can be actually raised here in Ethiopia? Yeah, for sake of actual introduction, the Ethiopia health system seems like this one. We have a 3-tier system. We have a primary level healthcare, secondary level healthcare, and tertiary level healthcare. So in the urban and rural contexts, the primary healthcare contains actually health posts, health centers, and primary hospitals. In the urban contexts, mainly focusing on health centers. So the catchment population is around 40,000 in urban, and also more than 113 in the rural community level. That's the primary healthcare catchment. In the secondary level, we consider actually general hospitals. In the tertiary level, we consider specialized hospitals. These are actually the health system and the health system of the country. So one of actually the factor in when we're actually talking about climate change is not coming from somewhere. Human activities, the main actually source of climate change. So the one of actually even the aggravating factors for climate change is population density and also population increment. As we have seen from the report, this is actually 2024 World Bank report. The central part of the country, this one, and some of the areas like Usana, Walaita Sodo, Dila, Jimma, that's more in the southwestern part of the country, and also here in Harar and Redwa are actually more populous. So currently the annual actual population growth is actually around 3.02% per year. And by 2060, we will reach more than 200 million actually with this rate. So the population increment have actually increment in the population pressure, increment in the resource distribution. Yeah, that's impacts on the resource distribution. Affects actually the deforestation rates and other impacts. So as a background, our population is actually increasing rapidly. So family planning activities, if we are thinking family planning activities, we can think of actually this also. Now there is some natural disasters related to climate. As you have seen from some of the national disasters or the frequencies also. One is drought. For the last 120 years, we actually experience 16 drought incidents affecting more than 77 million of the population. Earthquake, more ground movements, epidemics, especially bacterial incidences, viral and parasitic incidences, and floods, and also insect like locusts, landslides, mass movement. These are actually some of the figures that I use the World Bank data that's published by 2024. So you can, yeah, I just actually put the link in the reference, so you can use that one. The National Vulnerability and Adaptation Assessment, the VAA, Ethiopia. So you can get that one also. So you can further read the details. The other is the changes, especially risk of actual river floods and also extreme heats. Here, the left side is more river flood. So as you have seen from the picture, those in the southern part or in those majority of actually the geographic areas are actually at high risk of river floods. When you come to actually extreme heats, in the eastern part of the country is highly vulnerable or at risk of extreme heats. When we come to some figures, increase actually in terms of hot days per year. Currently in Ethiopia, 13.3 million people are actually at risk of actually increase in temperature, hot days and also nights. The other is the incident in vector, especially on malaria. Malaria for the last 3 years, from 2020 to 2023, malaria was increased by 12%, and with a projection of 50% by 2030 if you are not actually taking any mitigation and adaptation measures. So there will be actually significant malaria outbreaks within the next few years if you are not taking adaptive and mitigation measures. The other one is waterborne diseases. So especially floods and droughts have actually led to 35% of increment in waterborne disease, especially in cholera and diarrhea. That's watery diarrhea, which one is actually bloody. So cholera and diarrhea are actually will be increased by 35% if you are not taking adaptation. So waterborne disease also increment. The other one is school dropouts is increased, especially due to actual flooding and drought. There is mass displacement in also actually migrations. So because of that, is the school dropout will be increased by 15%, and also in the health infrastructures, the damage actually to the health infrastructures are increased by 20% from within these 3 years even. And energy insecurity also one of the impacts, one of actually the effects of climate change. When we come to actually the climate, the malaria risk map, as you have seen from the map, the western part of the country, from Humera, Amara region, Benshangul, here in Gambela, and southern Ethiopia, as well as here in Somali, as well as in the border between Afar and Amara regions, are actually at high malaria risks, whereas the central part of the country is actually malaria free. It's a highland part of the country. Now, Addis Ababa is actually reporting malaria. In the periphery of Addis, we have actually hearing reports of malaria. That means there is actually climate change within the highland areas. The other is actually rainfall triggered landslides. The probability, as we have seen from the map, in the central parts of the country are at a high risk of actually landslide. That's actually rainfall triggered kinds. The areas around Arbaminch and the areas around Redwa, Harar, and also near to Asalla. That's the eastern Hararghe parts of the country. This indicates we are actually at high risk of climate-induced challenges. The other one is related with maternal child health. So due to actually climate change, 40% of the youth lacks contraceptive information and services, especially because of actually infrastructure damage and also inaccessibility because of climate change. 40% of youth lacks this information, this contraceptive methods. In terms of malnutrition, especially on those who are actually in drought affected areas, 40% of pregnant and lactating mothers are malnourished in the drought affected areas because of different reasons. One is actually food insecurity. The other one is migration. The other one is over 30% of actually sexual and reproductive health services in drought affected regions are experiences disruption of services because of climate change. Because of climate change, there is actually increment in the gender-based violence incidents in climate affected regions, and also marriage, especially early marriage, was actually increased by 10% within this year because of climate change. That's linked with adolescent pregnancy and specifically in those drought affected areas. These are some of the food insecurity map. This is also taken from World Bank. The data was actually taken from World Bank by 2024. The data is actually mainly the 2-year data, 2022 and 2023. The data, as we have seen, there is high food emergencies in the northern part of the country, in the southern part of the country, whereas in the central part of the country, in the eastern part of the country, are more crisis and more stress level. They categorize as stress level. It's actually categorized by acute food insecurity phases. These are the phases of acute food insecurity phases. So these are some of the data because of climate change. What are the policies we have in hand, especially in the country? Ethiopia already ratified the UNFCCC by 1994, as is released. We already ratified that one. In the Ethiopian constitution, it's also included in the climate and environment areas are included, especially in Article 44. It have environment and climate related issues were included in Article 44 of Ethiopian constitution. When you come to health specific, the other sectors are actually developing documents like for agriculture, water, transport, communication. These are actually sector specific climate response programs and policies developed by the government in response to climate. So in the Ethiopian context, National Health Adaptation Plan to Climate Change was actually developed by 2017. So after that, we submit the NETC by 2025. And then currently, the updated NDC were already submitted by 2021 to 2025. So the third one is under updating. This is actually 2021 data. So currently by 2025, especially on December 2025, Ethiopia will submit the updated non-determinant contributors report for the UNFCCC. Thank you very much. Thank you. ሁላችሁንም አመሰግናለሁኝ። ስላይዱን I think share የሚደረግ ይመስለኛል. And then these are some of the further readings that we can get, and data, evidences, and we can actually for further reading purposes. Thank you very much. Elbetel, over to you.
Okay, thank you very much, Abraham. We will share a quiz link and survey so that you can get the certificate. But first, there have been a few questions in the chat, and I want to share those questions. The first one is from Abebe Kasa. He says that climate change and health is beyond a mere linkage, but one in the other. And he's asking you that as an expert, do you advise a vertical climate and health mitigation and response program in the public health system or integrating with the existing hardly responsive health system? And the second question is from Ando. He says that this was raised around the time that you were discussing the SDGs, the response, and he says that shouldn't SDG target 3.1, which I believe is maternal mortality, and 3.2, which is ending preventable deaths, shouldn't those be listed as well? And Johannes Taferra also raised a question that says currently there is an epidemiological shift of disease from communicable diseases to non-communicable diseases. So is there a resilient health system to the grassroots level?
Okay, thank you, Betel. Yes, I think for the next, actually, in the second and third webinar, we will discuss on details of the health resilience systems, how we can actually program the climate and health programming, as well as how we are actually advocating, and also how as a professional can use our service to be actually a tool for climate actions. So for the sake of actually replying, I think with the current, especially in the context of Ethiopia, program integration is much appreciated than actually standalone climate programs with the current health system and also the current health programs. Especially, for example, we can actually integrate family planning with climate because one of actually the stressor for or the reason why climate happened was the population pressure. So we can link that one. That's one thing. The other thing in the disease prevention and promotion interventions, we can link that one also as integrating climate within the health programs, as well as creating the health system by itself. Creating resilient health system is not a standalone kind of programming, rather integrating the climate components in the health programming and the vice versa. So I think we can think of my assumption is integration rather than vertical programs. Vertical programs, it may be because climate change is not actually standalone kinds of program. It affects actually the different programs that will actually affect many population, maternal child disease, especially the disease patterns, human community level interventions, and other issues. So I recommend actually program integration rather than vertical kinds of programming. When it comes to SDGs, I think, as I said, all the SDG goals are have actually link with climate change. But for sake of actually integration, for sake of actually discussion, I just actually point out some of the SDG targets in the slides. Otherwise, climate is actually affect the system, the entire actually development system. So when we're actually saying development system, it affects actually health, it affects water, it affects sanitation components, poverty interventions, women empowerment activities, different actually goals. For sake of actually time, I just actually point out some of the targets in the slide. That's why. Otherwise, majority of the targets in the SDG are linked with climate. The other one is in terms of epidemiological shifts. Yes, especially those vector-borne disease. Yes, there is a change from the communicable disease to non-communicable disease because of our lifestyle. Some of actually the hospital reports are more non-communicable diseases like hypertension, diabetes, cancer, and other issues. In the earlier years, actually, there are reports of diarrhea and other communicable diseases that can be caused by different causes. So, yes, there is a epidemiological shift. For example, if you are actually taking the malaria epidemiology, in the Ethiopian context, in the central part of the country, that's highland part of the country, are actually malaria free. Now, the malaria epidemiology shifted here in Addis. we are actually getting reports, malaria reports from the Addis Ababa health centers. That's actually epidemiological shift. So when we are actually thinking of health resilience health system, one of actually the basis was based on the epidemiological shift of the different impacts. So, for example, if you are actually thinking of malaria intervention here in Addis, based on the epidemiological the shifts, we will actually organize our human resource, our finance, our M&D systems, and others. So that's actually what to think. So one fact is here: climate change affects the disease epidemiological patterns and also epidemiological shifts. Thank you.
Okay, thank you very much. There were more questions that were raised, but one was on blood pressure. How is that related with climate change? You did explain this at the beginning. I think you said that. Do you want to take a shot at this?
Especially, yeah. One of actually the evidence that we actually get, especially in the sub-Saharan Africa, is mothers, especially the pregnant mothers, are affected by heat stress, especially due to actually heat stress and also actually increased temperature. Those actually pregnant-induced hypertension cases are actually increased. That will actually end up with miscarriage and other premature deaths. That's the evidence we have. So it have actually, yeah, in the link, you can get that also evidence and can further read. Yeah, thank you.
Okay. So one person also raised a question that will the fighting on climate achieve its goal without the commitment of developed countries, as they show reluctance, and the developing countries fighting alone will show fatigue. And there was also a question on policy issues and documents like SOPs, guidelines from the Federal Ministry of Health.
Okay, yeah. I can say no for the first question. Actually, the higher emitters of the greenhouse gas emissions are US and China. Currently, as we have seen from the Donald Trump executive order, they discard the Paris Agreement and actually out from the Paris Agreement. That's actually a huge loss for the climate sector and the climate space. That means that the greater emitters have to actually contribute in the reduction of actually using more reduced and also renewable energy, but this commitment is not accepted by the US government currently, for example. So without actually that developed countries' commitment, we can't achieve actually the goals on the climate change. That's a fact. The other thing maybe, in terms of the SOPs, I think the Ministry of Health have actually its own website. So there are documents. One is the revised Health National Adaptation Plan that's released last year in August, I think August 2024. They have actually the climate resilience guidance paper also online. You can access that one also. The other thing is one of the documents published by the Ethiopian Public Health Institute, especially targeting on the climate sensitive disease, early warning system, and emergency preparedness. You can get that document also from the Ethiopia Public Health Institute website. So there are some documents, but especially for the health sector, it's a relatively new. The climate is relatively new in the health sector. So we have to actually cooperate with the government, with especially with sectors, and also we have to actually develop such kinds of SOPs, manuals, and guidelines. There are different documents in the online with the ministry website. Yes, thank you.
Okay, so thank you very much, Abraham. In the chat, Dagmawit, you asked about the interlinkage between climate change and adolescent youth and sexual and reproductive health, how they're connected. They are very connected. I think you might have joined around the end if you haven't listened. Maybe can we take this as a last question and then we'll officially close?
Okay. Yes, I think mainly some of the actually the point is also the data that we actually presented related with service disruption. That's the service disruption related with family planning. SRH services will be disrupted because of climate change, because of floods. We may not get actually access to healthcare facilities, so that will affect the SRH services. The other thing is because of drought, for example, we may not actually access water supply for healthcare facilities. So delivery services and other services that we provide in healthcare facilities are provided without water supply. That is related with actual healthcare acquired infection, including SRH. The other one is especially climate-induced migrations and also in displacements have actually its own impact in the gender-based violence and school dropouts, which linked with sexual and reproductive health impact. So also, thank you very much.
Okay, so everybody, don't forget to join our Telegram group. We'll be in contact with you very soon. And also, I want to say very thank you to Mr. Abraham. And we can officially end this now. Good night, everybody.